Hi everyone, Dr. Raval, an avid advocate of keeping your own practice and building your brand through your practices. So today we're going to talk about this, the force of corporate ownership, overlying practices and how physicians practice. So there's been a lot of talk about this recently because more and more practices are owned by corporations, whether that be hospital corporations or private equity corporations or multi-specialty groups owned by a corporate entity. And the latest statistics are 80% of physicians are owned by some corporation and 60% of all practices. So what happens in this case? A recent letter, Physicians Advocacy, drafted it to the Justice Department to say that these corporate entities are exhibiting anti-competitive practices. So what does that mean? That means that there are decisions being made for the corporation that does not help the patient or the doctor. So what are these things? Number one, the corporate structure values money over patient care, meaning there is an incentive for seeing more patients by that doctor and spending less time with the patient. That also means that decisions are made because they cost less, not because it's the best thing for the patient. So doctors are being incentivized to offer care that will cost the corporation less, meaning maybe referring internally when you know there's a better entity to refer to. So two things that definitely do not help patient care: less time with the patient and decisions based on money, not the care of that patient. Also, there is an impact on clinical decision making. So if you're incentivized as a doctor to refer internally or to places that are not always the best for your patients, but you figure they'll get enough care, you now have to record in your clinical notes that this is what you're doing, but you're not putting in there all the negative impacts. You're just saying, I took care of this, I referred to this person internally. So we're seeing in clinical decision-making and clinical notes that are not to the best for the patient, and not saying anything negative about what kind of decisions they're making. This corporate ownership is affecting future policies. It's affecting picking up more practices and doing the same. It's pitting doctors and practices against each other because it's incentivizing how many patients you see versus the care that you get. By the same degree, it's also taking the feedback that these patients give and pitting one doctor against another, saying this one got better reviews than you did. So all different factors that have nothing to do with a patient deciding which doctor they want to see and why they want to see them, and doctors making decisions for what's best with the patients. So these physician advocacy groups have now entered the Justice Department saying these are all anti-competitive practices and it shouldn't be happening. And now that non-compete clauses are void, doctors can actually leave these corporate entities and start their own practices. So there's really no better time. I'm an advocate. I've written Physician Practice Blueprint. If you're re-entering your own practice or buying a practice, it's step-by-step on how to build your brand through your practice. Not just practice, but take control of your brand and spread your brand and help patients through your brand. So I hope that's very helpful to you. It's just information based on 35 years in practice, and I am still a solo practitioner.